Good morning to everyone present here. Today, I am going to talk about a medicine that almost every household has, a small white tablet that has become a silent companion in times of fever, pain, and discomfort, paracetamol. You might know it by different names: Panadol, Tylenol, Calpol-Crocin, or simply the fever tablet. It's one of the most widely used medications in the world. But despite its familiarity, few people truly understand how it works, what its dangers are, and how misuse can lead to serious, sometimes fatal side effects. My purpose today is to raise awareness, not to frighten anyone, but to educate everyone about the side effects and safe use of paracetamol. Because while it's considered safe when taken properly, even the safest medicine can turn into poison when misused. Paracetamol, also known as acetaminophen, is a common painkiller and fever reducer. It was first discovered in the late 19th century and became commercially available in the 1950s. Since then, it has become a part of almost every family's first aid kit. Doctors recommend it for mild to moderate pain such as headache, toothache, muscle pain, joint pain, backache, and menstrual cramps, as well as for reducing fever caused by infections. It's considered safer than other painkillers like ibuprofen or aspirin because it doesn't irritate the stomach or cause bleeding in most cases. But safe doesn't mean harmless. The difference between a medicine and a poison often lies in the dose. For adults, the maximum safe dose is usually around 4 grams or 4,000 milligrams per day, which means roughly 500 mg tablets in 24 hours. For children, the dosage depends on their weight, and it should always be given under a doctor's advice. However, many people don't pay attention to these limits. They take multiple tablets at once or combine different cold or flu medicines, many of which already contain paracetamol, and unknowingly exceed the safe limit. This overdose is one of the main causes of serious liver damage. Paracetamol works by blocking certain chemical messengers in the brain called prostaglandins, which are responsible for causing pain and fever. Unlike other painkillers, it doesn't reduce inflammation in the body, but it helps bring comfort and lowers body temperature. However, when the body metabolizes paracetamol, it breaks down into several compounds, one of which is n-acetyl-P-benzoquinone-MNA. Normally, the liver neutralizes this toxic compound using a substance called glutathione. But when too much paracetamol is taken, the liver's glutathione stores are depleted, and API starts damaging liver cells, leading to liver failure. Even with normal or slightly higher use, paracetamol can cause some common side effects such as nausea, vomiting, loss of appetite, mild stomach pain, fatigue, and in some cases, skin rashes or allergic reactions. Though these side effects may seem mild, they are warning signs that should not be ignored. Continuing to self-medicate despite discomfort can lead to more serious problems later. The most serious and life-threatening side effect of paracetamol is liver toxicity, also known as hepatic necrosis. In an overdose situation, the symptoms often appear in 4 stages. During the first 24 hours, nausea, vomiting, abdominal pain, and general weakness may occur. Many people ignore this stage thinking it's just the flu. In the next 24 to 48 hours, the person might start feeling better, but the liver is silently deteriorating. After 48 hours, severe liver damage occurs, leading to symptoms such as yellowing of the skin and eyes, confusion, bleeding tendencies, and even coma. In the final stage, liver failure can lead to death unless immediate medical treatment or liver transplantation is done. Globally, paracetamol overdose is one of the leading causes of acute liver failure, especially in countries like the United States and the United Kingdom. It's easy to see why misuse happens. Paracetamol is cheap, easily available, without prescription, found in many combination products like cold, flu, and pain relief medicines, and considered harmless by many people. Because of this, many individuals take it without consulting a doctor, sometimes several times a day. They don't realize that when multiple medications contain paracetamol, the total dose can easily exceed the safe limit. For example, if someone takes a cold and flu syrup, a headache tablet, and a fever tablet, all containing paracetamol, the cumulative effect can be toxic. One of the most dangerous habits is taking paracetamol with alcohol. Both substances are metabolized by the liver, and when taken together, they multiply the risk of liver damage. Many people take painkillers after a night of drinking to relieve a hangover headache, not realizing that they are putting their liver under double stress. Over time, this can lead to chronic liver disease or cirrhosis. Continuous or long-term use of paracetamol can also cause problems even at normal doses. The liver is a resilient organ, but repeated exposure to even small amounts of toxins can weaken it over time. Some studies suggest that long-term paracetamol use may be associated with kidney damage, high blood pressure, and even asthma like symptoms in certain individuals. In pregnant women, paracetamol is often considered safe for short-term use, but emerging research has raised concerns that frequent use during pregnancy may affect the child's development, potentially increasing risks of behavioral or attention problems. Though research is ongoing, caution is advised. Although rare, some people are allergic to paracetamol. Allergic reactions can range from mild rashes to severe anaphylaxis, a potentially life-threatening reaction that causes swelling of the throat, difficulty breathing, and a drop in blood pressure. In such cases, emergency medical help is critical. A major reason for unintentional overdose is ignorance of labels. People fail to check how much paracetamol a product contains. Some brands list it under its chemical name, Acetaminophen, which confuses consumers. It's essential to check the active ingredients on every medicine you take. Avoid combining 2 or more medicines that contain paracetamol and never exceed the recommended dose written on the label. If you are unsure, always ask a doctor or pharmacist before taking any over-the-counter medication. If someone has taken too much paracetamol, it's a medical emergency. Immediate treatment can save a life. The antidote is a drug called N-acetylcysteine, often referred to as NAC. It works by restoring the liver's glutathione levels and neutralizing the toxic NAQI. But timing is critical. It must be given within 8 to 10 hours of the overdose for the best results. Therefore, if anyone experiences nausea, vomiting, or abdominal pain after taking a high dose, they must go to the emergency room immediately, even if they feel fine. We live in a time where self-medication is common. Painkillers, antibiotics, and multivitamins are taken without thought or guidance. While it's understandable that people seek quick relief, it's also dangerous. We must remember that no medicine is completely safe. Every tablet we take affects some organ, some cell, in some way. As responsible citizens, we must educate ourselves and others, especially children and elders, about proper medication use. Keep medicines out of children's reach. Never share your prescription with others. Always read the leaflet. And above all, never ignore dosage instructions. Doctors, pharmacists, and nurses play a key role in promoting awareness about paracetamol use. They should always remind patients about safe dosage, check for possible drug interactions, and educate them about combination products. Pharmacists, in particular, must ensure that patients buying cold or flu medicines understand if the product already contains paracetamol. Let me conclude with a simple but powerful message. Paracetamol is a friend when used correctly, but a silent killer when abused. Every year, thousands of people around the world suffer liver failure or die because of something as small as a fever tablet. It's heartbreaking because it's preventable. We must not take the simplicity of this medicine for granted. Let us make a collective promise today to use medicines wisely, to spread awareness, and to protect our families from the hidden dangers of misuse. Because awareness is the best medicine and prevention is the best cure. So the next time you reach for that small white tablet, remember, it has the power to heal, but also the power to harm. Use it with respect, use it with knowledge, and use it only when necessary. Thank you.